Good morning. My name is Lowell Adams. I'm a student at Liberty University in the Masters of Public Health program, and this morning I would like to go through a presentation on my practicum and talk about what I did for my practicum. And to do that, I'm going to give you an overview of the program that I was involved with so that you can make sense of why my practicum part was important to the overall program. I've also supplied a PowerPoint that you can go along with this video. It just has some bullet points to kind of guide through the thought process and also to help keep me on target with what I'm saying here. So our first slide says introduction, and in the introduction, one of the things we have to talk about is the idea that we are having an increased number of people needing health care in this country. Couple of things that are involved in that. One is that there's more people coming into the country every year, whether through legal immigration or illegal immigration. All of that adds to the pressure on healthcare and the healthcare systems to be able to provide adequate care and and to be able to care for these people. The other thing is the baby boomer generation is coming to retirement age, which also brings a lot of pressure on the healthcare system to care for these people who now are developing chronic diseases. And we see in our second bullet point there, increased number of people with chronic diseases. And chronic diseases are things like diabetes, hypertension, coronary artery disease, asthma, COPD, obesities, things like that that are just, once you have them, outside of obesity, once you have these diseases, they really don't go away. And you have to learn how to manage them and to care for them. And a lot of the elderly population, this is the illnesses and ailments that they have, and so this increases pressure on the healthcare system to be able to care for these people. All of this adds up to increased cost. And the increased cost is becoming a huge issue within our government, within private sector, within our country as a whole. Healthcare dollars, healthcare costs is going through the roof in every aspect. So as we know, in the last few years, the government has been involved in trying to solve some of these issues. They've come up with the Affordable Care Act. The jury is still out on whether that is a successful program or not, but it's an attempt that they are making to try to help control, to make things affordable, to try to alleviate this dilemma that we're finding ourselves in. One of the other things that is adding to this from the private sector and the government, in an attempt to alleviate their burden on this, has put into play things like with the Medicare, where if someone is readmitted into the hospital within 30 days with the same diagnosis or similar diagnosis of what they were admitted with in the first place, the hospital healthcare system does not get reimbursed for their readmission stay. This, of course, adds incredible cost to the healthcare system, because that's money they just have to eat, and they can't turn the people away. They have to treat them, but they don't get reimbursed for it. So all of this kind of brings to a head the picture of where we're at and the issues that we have. Martin coordinated the Martin Coordinated and Affordable Care Program is a program that was designed and put together by a clinical pharmacist who works with the Martin Health Care System which is in Martin County, Florida, and Port St. Lucie, Florida. Port St. Lucie, Florida. And this program was designed and put together with the emphasis of saying, okay, how do we help reduce the readmission rate, thus saving hospital money and healthcare money, and reducing the lost revenue of the hospital system. And so we'll go to our next slide. And this is where we talk about the methods of this program. So the idea behind this program is that we want to be able to work with primarily those people with chronic disease, and to try to keep them, help them to become healthy, and to keep them from being readmitted on a chronic basis into the hospital. So the first part of the method is to identify people at risk. And this takes a collaborative effort. It involves physicians, nurse practitioners, PAs, doctors' offices, discharging nurses. We have pharmacists involved in it. It takes a whole conglomerate of people who are looking for these people that are at risk for this readmission of these chronic diseases, those people who have their disease out of control and are not managing it well, and they are then referred into this program, and it is voluntary. They have the choice of coming or not coming, but for those who do come to it, it seems to be very helpful. The second part, and there's actually 2 bullet points that go with this, is the promotion of behavior that reduce risk of chronic uncontrolled condition, and promotion of medication compliance and self-management. So the second part of the program is about health education, and this is run by the clinical pharmacists, and they bring these patients who are referred to them into their office and into their program, and they do an extensive review and put them through a series of questions and tests and so forth to help to identify the issues that are making these people to not be able to control their disease process. And so through this process, things that they're finding are where people, maybe they're isolated. We live in South Florida, which has a lot of retired people here, and often retired people, family members live thousands of miles, hundreds, thousands of miles away, and so they don't have a close network of people that they can rely on for support, and so sometimes they're somewhat isolated. For some, it's financial issues. They can't afford the medicines. Maybe they're on Medicare, and Medicare pays for certain parts of their medicines, but if they're needing diabetic insulin and so forth like that, it's difficult for them to get this medicine. And then, of course, we want to be able to teach them how to self-manage. The third part of the methods is link clinical care with community-based therapeutic, preventive, and wellness interventions. And that's the part that I was involved with in my practicum experience. And we were working on identifying community resources and helping to connect people to those community resources so that they would have that support system and structure within the community. We'll go to our next slide. We have 2 slides here that talk about results. In this slide, you can see where this is talks about the results of the program itself, and to monitor, is it actually working, is it coming together, is it developing in the way that it should. And this diagram shows that how we've had an steady increase in patients, we've had a steady increase in doctors becoming part of it, we've had a steady increase in offices, clinic offices that are becoming part of the system, and everything is working well in the collaboration. The second slide here, the next slide, with results. This shows 6 patients who came in with high A1C tests, which monitor blood sugars. And through this program and what we were able to do with the clinical education, all of them had remarkable decreases in their A1C levels after a period of 3 to 7 months. So this is a result showing the positive nature of what this is doing for the patients, and how it is working well. Excuse me. Then we'll go to our last slide, and this is our discussion and recommendation slide. First of all, this program is in the first year of 3, has very encouraging results so far. The healthcare system has given this program 3 years to prove its worth, and to show that it can reduce healthcare dollars, that it can keep people out of the hospital, that it can be a productive part of the healthcare system and the public health of this community. And again, so this is our first year in the program, and with the program running, and so far we have good results. Their second bullet point there is collecting information and meeting community partners, and that is what I've been doing, connecting with United Way, with free clinics, with the health department in 2 different counties, connecting with non-for-profit organizations, and seeing what programs they have available to help assist these patients in their homes or in the community to become that safety net, that support system that they need to be able to maintain good health and control their chronic disease. And then the last one there is a recommendation that I would love to see, is that as this program develops, that we become more involved in expanding to develop community groups and resources. One idea would be to develop like a parish nurse program that is supported out of the Martin Health System, but allows churches and religious organizations within the area to have parish nurses that can provide health education, provide different aspects of public health, and that way to be able to get our message out to a broader population and to become more inclusive and enabling our clientele and within these communities to be able to maintain their health and to have a good life. And that's the sum of my presentation. Thank you.